Cool. Good morning, everyone. Thank you for joining us as part of our Restart Heart Week activity here at Kent Surrey Sussex Air Ambulance. Essentially, today we're aiming to teach as many people as possible how to save a life. We are struggling a little bit with the audio, so if you can hear us, stick something in the chat. I guess if you can't, you won't know to stick something in the chat, but you may stick something in the chat. There's a couple of no's. We're just going to puzzle out the tech for a second. Do you want to stay with us for a second, Dave, or do you want to put a hold in screen? We're going to stay with us because I think we can hear on some of the platforms, and we'll just puzzle it out in the background. What we'll also do, if the tech absolutely falls apart, we'll put a link to one of our pre-recorded sessions in the chat. And if it all falls apart and doesn't work for you, we appreciate you giving us some of your time today. So you can join on the pre-recorded, and it's a very similar session, just not quite as interactive, back and forth. So why are we doing this, Stu? Why is this so important? We've got over 25,000 people signed up to learn CPR defibrillation with us so far today. We're targeting a much bigger number over the course of the day. And over the last 2 years, we've trained nearly 100,000 people in how to do CPR. But I guess, why are we doing this? Well, we're going to teach every single one of you this kind of concept of how to save a life. We know that the actions of people before the ambulance arrives or before our team arrive can have a huge impact on how people get on. So we're going to show people a couple of things, aren't we?
Yeah.
So if we talk through the 6 things that we're going to show them, we're going to show them, number 1, how to check for dangers and kind of how to assess someone's level of responsiveness, aren't we?
Yeah.
Number 2, do you want to talk them through number 2, if you can see it on the screen?
Yeah, how to call 999. It's really important that you don't get sidetracked and get task focused, but looking after the patient without dialing 999. It's really important that you remember and you give your exact location. There's a few apps out there. What 3 words is really, really good for making sure your location is accurate.
Cool. We're going to speak to some of the people who are kind of specialists within that. So we're going to speak to some of our dispatchers, we're going to speak to one of our pilots, and then we're going to actually show you how to do CPR. We've got some mannequins in front of you, in front of us, but for yourselves, you can use a cushion, a pillow, a rolled up jumper. All of that will work for what we're going to show you today. The key thing is just having a go and showing that you can do it. And then the final 2 bits from us, we're going to show you how to use a defibrillator. Stu's got one just next to him down there. Then we're going to show you how to use that and actually how easy it is. And then we're going to catch up with our medical director at the end to understand kind of how your actions can help us deliver interventions and hopefully save even more lives. So why are we doing this? Well, we know that across the southeast, every single day, about 25 people suffer a cardiac arrest outside of hospital. And despite the system as it is at the moment, only about 1 in 10 of those survive to hospital discharge. And we know that our aircraft can get anywhere within the southeast within 30 minutes. But for people in cardiac arrest, that's not quick enough, is it? And I think the key thing here, the key figure that we talk about lots, is there's a 10% fall in survival for every minute that CPR is delayed. And therefore, this isn't something that you can leave to someone else. This is something that people like you, every single member of the public, has got to have confidence to step forward. Okay. So we said that survival is about 10%, only 1 in 10 survive. But we know that for people who get defibrillation within 3 to 5 minutes of cardiac arrest, it has a 50 to 80% survival rate. Okay. So it's a really time-critical problem that actually you guys, by the end of today, will have the skills to potentially start to treat and start to help people. What we're going to do, we're going to hand you over to Paul, who's one of our patients, and he demonstrates really well how the actions of people like you before our medical teams arrive can have a huge influence on outcome. So having seen how important CPR is and the difference you can make as bystanders, we're going to give you kind of the initial steps in how to save a life, essentially. And all this links around the chain of survival that you've just heard about. So we're going to talk through this kind of concept of doctor's ABC, and we start that with danger, don't we, Stu?
Yeah.
So do you want to talk us a little bit around, anyone who's done a first aid course, there's that check for danger thing at the start, isn't there? And we often skip over it, but actually it's a really important step, isn't it?
Yeah, absolutely. For example, you're in a car park outside a supermarket, you see someone collapse, and you think actually you're in quite a safe environment, but actually, and you may rush towards the help, and which is the right thing to do, but also you've got to be aware of those dangers. Other people driving cars, people reversing, and other people panicking around you, and suddenly you can find yourself in what seems a quite a safe environment becomes suddenly a very dangerous environment. And because you're focused on looking after somebody, it's very easy to find yourself putting yourself at risk.
Yeah, and we know that what caused that person to collapse or become injured may also affect you. So, we talk when we train the ambulance crews around multiple people who have collapsed. You've got to have a suspicion that something, there might be something in the atmosphere or something going on, don't we? Yeah. But we see on the news every single year, don't we? We see these cases of rescuers becoming injured every single year, whether that be people going onto the frozen lake or into the sea to go rescue others or animals. And actually putting yourself at risk is one of the worst things that you can do, isn't it? Because then you end up with 2 casualties rather than just 1. So having checked for dangers, the next thing in our doctor's ABC is to check for a response. Yeah. And I think this makes some people nervous, doesn't it? We hear this when we work in the ambulance control room. We hear calls where people say the person's not responsive, and our call handlers will ask them to go see if they can get any response, and people be worried about getting in trouble doing this, won't they, Stu, or doing the wrong thing. So I guess that's the first thing, isn't it? Do people get in trouble if they try and, say they're walking down the street and they see that person unresponsive at the side of the street? Do you know of anyone who's got in trouble for trying to get a response from someone?
No, absolutely not.
No, we know acting in their best interests. There's not cases, is there, where people are getting in trouble for that? If you're clearly acting in someone's best interests and concerned for them, trying to wake them up is a perfectly acceptable thing to do.
Being kind to people, you won't get in trouble for being kind to people.
Perfect. And someone's talked here about kind of pinching the ear, trying to get a safe response. Yeah. So that's pretty much what we do, isn't it? So we talk about kind of this concept of shake and shout. Okay, so using a nice loud voice, but also giving them a firm shake on their shoulders, don't we? And actually that's a fairly safe place to kind of try and get a response and it not be, put yourself at any risk in any way. So what we're doing is exactly as we've got here, a nice firm shake on the shoulder and a nice shout in their ears, just saying, are you awake? Can you hear me?
And I know people feel uncomfortable about touching people, but it's really important to be very tactile with our patients and give them that firm shake.
Yeah. Now, we're going to talk, we've talked about checking for danger and checking for getting a response, but actually we're going to talk you through the process of calling 999, because if you've never done it before, it is a little bit alien, isn't it? But there's definitely some tips and tricks. And when you've got someone who's not breathing, we want to get help to you as quickly as possible. So we're going to hand you over to Carol, who's one of our dispatchers. He works in our 999 control room. You'll probably be able to even hear some of the emergency calls going on in the background. But she's going to give you a couple of tips and tricks around calling 999, because that could be one of the most stressful phone calls you ever make. Now, as you listen to Carol, I want you to just have a little think about, essentially, we talk about this lots with our teams. What is your process? So, if you work in a big business, where's your nearest defibrillator? Who's going to make this call? Is the front entrance easy for the ambulance to find? If you're at home, if it can be you, is it your children? Is it another partner? Would they, in certain cases, know the address? Would they know who to call and get help from? And then finally, in your school, in your business, wherever you are today, if you've got a defibrillator, how long would it take you to get it to the furthest point? Is one defibrillator enough? Would you actually need more than many? So we're going to pass you over to Carol, and she's going to just talk you through some tips and tricks around that process.
Hello.
Cool, so welcome back everybody. So Carol gave us a couple of tips around calling 999 and making that potentially really stressful phone call. And Stu, you've got a really good way of kind of summing up 3 big principles here, haven't you?
Yeah, I'll just keep it simple and try to remember the 3 C's. Stay calm. If you start panicking, panic is quite infectious and then everybody else panics. So just try and stay calm, and you'll find that will help you through what you're trying to achieve. Be confident in what you're doing. You know, chest compressions requires confidence, and if you're not confident, you won't do it effectively. So be really confident what you're doing, and also be careful. You know, we talked about the dangers initially, but those dangers can come at any point during the point where you're looking after a patient. So yeah, still be careful and be mindful of those dangers around you.
Well, now that the team have called 999, we're going to talk them through a little bit of what happens next in our system, doesn't it? So Carol will be looking for certain calls to send our helicopter to, and cardiac arrest is one of those calls that we will sometimes send the aircraft to in certain situations, isn't it? And so we're going to show them our helicopter. We're going to talk them through that bit. We're going to hand you over to Suji, who's one of our pilots, who's going to talk about the aircraft, as well as some of kind of the special dispensations that allow us to fly 24 hours a day, all through the night, 365 days a year, including through controlled airspace, such as the London airspace, through Gatwick, through Heathrow, in order to allow us to get to patients as quickly as we can. Perfect. So we're going to just recap what we've done so far, because I think as we start to pull things together, you'll realise how simple all of this is. Okay, so we've talked about checking for danger. We've talked about checking for a response and that kind of shake and shout process of getting someone away. We spoke to Carol, who's one of our dispatchers, talking around the tips of calling 999. And then finally, we've just caught up with CG, who's talked us through the helicopter and how essentially some of those skills allow us as a charity to get to patients really, really quickly within the South East. But now, essentially, we need all of your help. That's why we're doing these sessions today. I think what you'll be picking up in terms of the theme is that we know if someone's heart isn't beating, we need you to start intervening before the ambulance or the helicopter arrives. Because remember what we said at the start, survival falls by about 10% for every minute that CPR is delayed. So Carol's just talked us through kind of the two questions, hasn't she? She said when you call 999, they'll ask two questions, Stu. Do you want to just remind us what they are? The first one is...
So the first one is a person awake?
Yeah, so that, essentially, we square away, don't we, when we're checking for a response? Yeah. We'll find that answer out by doing our shake and shout. And then the next question they're going to ask, if you answer no to them being awake, what's the next question Carol's going to ask, or her colleagues?
Are they breathing, or are they breathing normally?
Yeah, are they breathing normally? Which is really easy for us to say, isn't it?
Yeah.
But actually, what is abnormal breathing? And when we listen to 999 calls in the control room, we know that people struggle with this, don't they?
Yeah.
Or they might be breathing but not quite right. And what is not quite right?
So you get those patients who are not breathing at all, and that's fairly obvious. You'll get some patients who just have long pauses between their breath. Okay, and I guess you'll see that, and you'll see their colour change as well. So their breathing is, they'll take a breath and there'll be an extraordinary long pause between the next breath. They may be snoring, especially if they're laying on their back. They may have this really deep snory airway, and you can hear it, and it sounds right at the back of their throat. This very, very snory airway. And then finally you have agonal breathing, and the best description I can think of is if you take a fish out of water, how that fish is breathing, where the mouth is opening and closing at a normal rate. However, there's no air going back and forwards, and it looks quite primitive. Okay.
And we know that agonal breathing's a real issue for us, isn't it?
Yeah.
Because actually people can mistake agonal breathing for the person breathing. So I guess if we put that into practice, Stu, what we're asking people to do is do this kind of head tilt chin lift, aren't we? So yeah. I don't know if you want to show them on your mannequin whilst I talk through it as well. So we're going to kind of 2 fingers under the chin, hand on the top of the head, and we're going to tilt it back. And then we're going to look for those kind of that breathing patterns that Stu talked about. So if they're breathing normally, fantastic. But like we said, if they're not breathing, if there's long pauses, if they're snoring, or they're trying to take these gasps, they look like that fish out of water, then that would be abnormal for us, wouldn't it?
Yeah, absolutely.
And yet we talk about like look, listen and feel, don't we? So this idea that you've looked in the airway as you tilt it, and then you can get down nice and close, listen to the sound of their breath, and by looking down the chest, you'll actually be able to see it moving up and down. So if someone's doing really shallow breathing, it'll be a lot easier to see down there rather than trying to look over the top. The same if they've got really thick clothing on. You may have to peel some of that clothing back, or even just be able to look down the length of their body, and that might be able to help you.
And especially with that agonal breathing, the fish out of water breathing, when you're looking, you can see the mouth opening, but as you look at the chest, there will be no rise of the chest.
So if they're not breathing and they're not awake, we're going to start CPR, okay? And that's what the call handler is going to tell you to do. And you'll notice we've not checked for a pulse, because we know that people struggle to find pulses, and actually what they might find is their own pulse. With their blood pressure pumping, they might feel they've something, but it's actually their own pulse. So we don't tell you to check for a pulse, and we recognise, it's a well-recognised issue that you may do CPR on someone with a pulse at this point, and they may wake up and they may push you away. Okay, that is absolutely fine. Nobody gets in trouble for that. And when I work in the ambulance control room, I hear that happen every single day. There will be cases where the call handlers will tell people to start CPR and the person starts to wake up and pushes them off. I don't know of anybody who's got in trouble. I don't know of any national case when I've looked through the data of people getting in trouble trying to deliver CPR. Okay, so it may be that the person has a pulse and you start CPR, and if they push you off, that's fine, because the risk of not doing CPR is so extreme, and mistaking it for a pulse. Hopefully that gives you some confidence. Now in terms of how we deliver this, okay, we're going to talk you through essentially showing you Stu. So we're going to do, first things first, hands on top of each other, as so. Okay, you're going to have really straight arms, okay. What we want to be doing is using your body weight essentially over the top of the patient rather than small muscles in your arms. And then you're going to place the heel of your hand in the centre of the person's chest. And the easiest way to do this is to draw an imaginary line from armpit to armpit, okay? And put your heel of your hand in the middle. You can put your other hand over the top, you can hold onto your wrist, you can go sideways, you can do essentially whatever you want. Most people will interlock their fingers, but the key thing is, as Stu is doing, you've got nice straight arms and your shoulders are over the top of the patient. And then what you're going to do is you're going to push down 5 to 6 centimetres about 2 times a second, okay? Now, what we've been telling the children when we've been working with young children today, we've said push as hard as they can, okay? But for adults, we're saying you're aiming to push down essentially about 5 to 6 centimetres. And just to clarify that, that's when children are doing CPR, not push as hard as you can on children. So we're just talking about adult CPR. As adults, you would push down 5 to 6 centimetres. If you're a young child having to do CPR on another person, push down as hard as you can. Awesome. Have a little go now. Please do. Like, I appreciate there's some people with cameras on and we can see you out there, but please do have a go. If you've got a pillow or a cushion or something in front of you, just have a go. Hands on top of each other, interlock those fingers, arms nice and straight, and just that muscle memory of pushing down nice and firmly about 5 to 6 centimetres 2 times a second, okay? This is all about, I'll let you stop, this is all about just having the confidence to do this, okay? Now, whilst you're having a little go, I'm just going to have a quick look in the chat. Yeah, someone said around making some noises, almost animal-like during that breathing phase, and I guess we sometimes hear that, don't we? Yeah. We're agonal breathing. And yeah, someone else has said someone appeared to have a pulse, but it was a red herring. It's really difficult, isn't it? These are really stressful situations, and that's why we teach this in such a simple way, because we recognise that not doing something is actually worse than doing it. You're safe. You're not going to get in trouble, yeah. And actually, the lesser risk is doing something. So you're going to do CPR until essentially 3 occasions when you can stop, aren't they, Stu? Do you want to talk us through some of these 3 occasions? Yeah,
if the patient actually wakes up.
Yeah. So like we said at the start, if you start CPR and the person pushes you away, makes purposeful movements, the really key thing, isn't it? So purposeful movement, eyes open, they can stop. Yeah. What about number 2?
When the emergency services arrive and then take over.
Yeah, and the latter part is really important in that, isn't it? We want them in the room with you. It's not when they pull up in the street. And if you're doing a good job, actually, and you're not too tired, they'll probably leave you to carry on, won't they, whilst they set up. So when they tell you they'll take over is when you want them to do it. And what about number 3? Hopefully number 3 is rare, but it can happen.
But you can find yourself, your own fitness, and you get tired yourself. So, and you make yourself unwell. So at a point of time, this hand over to someone else to do.
Perfect. So we've shown you kind of through CPR. The other half of this bit, so CPR buys us time, essentially. CPR is around compressing the heart and moving blood and oxygen around the body and buying us time until we can restart the heart. And the way to restart the heart is generally through either some drugs that the ambulance crews carry, some ventilation that they can do, or through a defibrillator. And we're actually going to show you how to use a defibrillator because these are so simple to use. So I guess a couple of key principles to talk about with these, Stu. A bit like the CPR, yep. You can't really get this wrong, can you? So these defibrillators will not allow you to shock someone with a pulse. So you cannot shock someone with a pulse, and they will not allow you to cause harm, really, will they? Shall we walk through it? The key thing here is to follow instructions, okay? So Stu's found this person who's collapsed, and he started CPR, okay? And he sent me to go get a defibrillator. And I've arrived with this defibrillator, okay? All we're going to do is we're just going to turn it on and follow the instructions, okay?
For emergency medical services, now, adult mode. Follow the voice prompt calmly.
So every machine will tell you exactly what to do.
Clothing from chest and stomach.
So you will need to access the person's chest. These sets will come with scissors, but you need to access the chest to be able to get the pads onto skin, okay?
Tear open the pads packaging.
Okay, so when you open the pads, you will get 2 pads, as say,
Look
all right?
closely at the picture on each pad.
Each pad,
Peel off the
okay,
pad
I appreciate you won't be able to see that. One will have a
to
picture
the
in,
bare skin of the
and
patient.
one won't. And I'm going to bring that
Exactly as
up
shown
to the
in
thing.
picture.
Hang in there, Stu. So you've got
Peel
2
off the
pads,
pad labelled
both the
2
pictures,
and stick to the
and I'll
bare
show you
skin
where
of
to
the
stick them.
patient. Exactly as shown in the picture.
So we're going to stick pad number 1
The pad firmly
in the
to
top
the bare
left,
skin of the patient.
and pad number 2 is going to go underneath the left
The
armpit,
picture on each pad.
okay? As soon as the pads are on the chest, the machine will start to recognise it, and it will tell you to stop touching the patient.
Analysing heart rhythm.
It's going to analyse, and it will tell you to shock or not.
Stand clear.
So if it wants to shock,
Flashing orange
all you need to do
button
is short press the flashing button.
now.
Check everyone's clear,
Shock delivered.
quick press, and as soon as the shock's delivered, you're going to restart your CPR,
Begin CPR
Okay.
now.
and it will tell you to do that.
Blue on button for CPR voice prompt.
It will give you a metronome as well on here,
First.
so it will tell you how quickly to press.
System shutting down.
So it's as simple as that, okay? The machine will put the pads on the chest, it will analyse the rhythm, and it may or may not ask you to deliver a shock. If it doesn't want you to deliver a shock, it doesn't mean you're doing the wrong thing, okay? The key thing is that it's just not a rhythm it can shock, but it doesn't mean you're doing the wrong thing. Stu, should we put this together from start to finish, just so everyone can see this doctor's ABC kind of come together? Yeah. So if I just wrap these pads back up,
Okay.
and we'll stick these on and on. Cool. So we'll walk through this from start to finish, and you can kind of show them and I'll talk if you're happy.
Yeah, absolutely.
So we found this person collapsed at the side of the street, okay? They've collapsed, they're not responding outside the front of our building. So the first thing we've done is we've called 999, okay? And as we're calling 999, we're checking it's safe. We're checking for dangers, all as we talked about. The next thing they're going to do, we're going to check for response, okay?
Can you hear me? Hello, can you hear me?
So we're doing that shake and shout, seeing if we can get a response. Remember what the 999 call handler is going to ask you. They're going to ask you 2 questions. Are they awake? We already know the answer. And the next question, are they breathing normally? Remember what we talked about around how to assess this. Tilt the head back. You're going to look, listen and feel for breathing for 10 seconds. Okay? And remember the things that we said were abnormal. Snoring, long pauses, obviously if they're not breathing, but also these agonal gasps that we've talked about. So they're not breathing at all, Stu. So therefore we're going to start CPR. So exactly as we talked about, hands together, heel of your hand in the centre of the chest, an imaginary line from armpit to armpit, and you're going to push down 5 to 6 centimetres. If a defibrillator is available, we're going to use it and we're going to follow the instructions. So we're going to turn it on. Put it there, hopefully, so you can see.
Call emergency medical services now. Adult mode. Follow the voice prompt calmly.
So it's going to feel slow, but flow is smooth. Smooth is fast. We will get there. So clothing off.
Take out the pads from the bottom of the device. Tear open the pads packaging.
So pads out, and we're going to start to stick the pads on. Now, following the instructions that are on the pads.
Look closely at
You
the
cannot
picture
get the
on
pads
each
the wrong way round. So if you stick them the wrong way round, it doesn't matter, but you do need to get them in the right places.
To the bare skin of the patient, exactly as shown in the
So
picture.
pad number 1 on there, pad number 2 underneath the armpit.
Labelled 2.
Stu doesn't stop CPR
Touch.
until the machine says. So I stick the pads on around Stu.
Shock advised.
So it's advising a shock.
And
We're going to make sure we're nice and clear the top, middle and bottom.
now.
And there's a flashing orange button,
Now.
and we're going to press that.
Shock delivered.
The shock's delivered straight away, and Stu goes back on the chest to carry on CPR.
Now.
Again, like we said, you're going to carry on this even until the person wakes up, the emergency services arrive, or you're physically too tired.
In 2 minutes. System shutting down.
Perfect. So having done a full recap, what we're now going to do is we're going to hand you over to Duncan, who's our medical director, one of our doctors here, and he's going to talk a little bit around kind of future practice and our horizon scanning. Okay. The key thing is all of the innovative stuff that we do here at Kent Surrey Sussex Air Ambulance is built on the foundation that you all do, delivering CPR and defibrillation before we arrive. So we're going to hand over to Duncan for this. We're going to take some questions and answers at the end. So if you have got any questions, please pop them in the chats across the varying platforms, and we'll answer those kind of when you come back to us in a couple of minutes. Thank you.
So thank you everyone for So thank you everyone for joining us today and forming part of our army of lifesavers that we're trying to create across the southeast. Now, I'm joined by Duncan, one of our doctors here at KSS, and what we want to discuss over just the next couple of minutes is what we're doing to try and help cardiac arrest survival within the southeast. Now that you are all helping us with that chain of survival in the first few steps that we've talked about, we're going to tell you what we're doing to kind of support you in that fourth step. Now, Duncan, we've spent the whole day training people. We spent last year training people and trained literally thousands of people how to do CPR. And I think there's many people out there that think it's just too difficult. They're worried about performing it. What can you say about the importance of it and what it means to us as a charity?
So early CPR, chest compressions and early defibrillation is the key part in increasing survival in patients who have cardiac arrest. And we can't stress that enough. And we know that it doesn't matter how old you are, it doesn't matter what your background is, everybody can play a part in delivering that. It doesn't matter whether you're 7 or 79 or 90, everyone can perform CPR and everyone can use a defibrillator and everyone can be a lifesaver.
Yeah. And in terms of what we're doing, we've talked, the team have learned about the chain of survival today. And that fourth step, the post-resuscitation care, and also the advanced therapies that we can deliver. We're looking at pre-hospital ECMO, aren't we? Or certainly in the early phases of exploring that. Could you just, simply explain what that means and why it's still really important that everyone does those first steps that we've talked about today?
Yeah, so you're right. We are looking at new interventions to increase survival from cardiac arrest. And one of those, as you mentioned, is ECMO. And ECMO is a machine that we can now carry to the scene. The machines are now small enough that we could carry it in the helicopter. And that works as a mechanical substitute for the heart working as a pump. And it's a really exciting technology. We're not sure exactly how we'll be able to deliver that, but it's certainly something we're looking at. But the key part to ECMO and all of the innovations in terms of how we manage and how we improve survival from cardiac arrest, all of them are dependent on the patients receiving early good quality CPR. And that's the part that the public can play a really important role in, because without that early CPR, the interventions that we might be able to bring to the patients are going to be far, far less effective.
Completely agree. And I think the other thing to talk about is, the team would have learned about the chain of survival. And we talked about that third step, the early use of a defibrillator. But what we know is that sometimes there's not one immediately available. And so we've started to look at something around drones, haven't we, around that? Can you just explain a bit more about what that might look like?
So as I say, we know that early defibrillation is really important in improving survival, and access to a defibrillator is a really important part in that. There are public access defibrillators, but not everyone will have one close to where their loved one or a member of the public has their cardiac arrest. So we're looking at ways that we might be able to deliver a defibrillator to scene even more quickly than than we can through the helicopter. And drones is one way of doing that. There's some complexity around the use of drones, but we're working with the Civil Aviation Authority to see what we can do around that really important part of getting the defibrillator early to the patient.
And I guess kind of the last step for me is talk about what we deliver at the moment, isn't it? And again, that fourth step on the chain of survival, the post-resuscitation care. We already provide advanced post-resuscitation care as a critical care service. We've talked about what's the future, but what do we provide at the moment? What does that mean for patients out there?
Yeah, so the air ambulance team bring a number of different skills to the patient, particularly around the cardiac arrest patients. We have equipment with us and skills with us to be able to monitor blood pressure at every beat of the heart. And that helps us really give the heart the best chance of recovery. And we can also deliver an emergency general anaesthetic on the scene, which is an intervention that is usually done only in hospital. And again, that allows us to control the patient's breathing, how much oxygen they're getting, and it makes sure that they're as comfortable as they can be after a cardiac arrest. So those are really important interventions, and they can improve outcome themselves. But I would just really stress that the most important bit is the early CPR, the early defibrillation, and without those two things, which the public can really help us with, our interventions are much less successful.
Agreed. I think, our take when we're writing this programme is that this is a team effort, isn't it? This isn't, the community doing their work or us doing our bits. It's a team effort and everyone working together to save a life.
Yeah, absolutely.
So I guess the final thing to say is thank you for joining us today. We've learned a number of things. We talked about the chain of survival, and ultimately, hopefully, we've now got thousands of extra lifesavers out there helping us to save even more lives in the community. Thank you.
Lovely. Welcome back, everyone. So we've got loads of awesome questions, actually. Sometimes I have to stretch the truth and say we've got questions and ask the questions myself, but we have actually got loads of questions. So we'll try and get through as many as possible, and then putting people on the spot, I think we should take a selection of the questions today and ping them out on social media throughout the day. It's a half a nod behind the screen. We'll see what happens. So what happens if you do CPR too fast? We talked about earlier, Stu. What happens if you do CPR too fast?
Essentially, the heart doesn't fill with blood, and therefore you're not pumping any blood around. It's just like a pump, and if the pump is going too quickly, it isn't able to fill, therefore not able to pump blood around, therefore not perfusing the oxygens, giving oxygen to the brain and other vital organs.
And I think the key thing here is actually doing something is better than nothing. Yeah. So we know people worry about getting it wrong, but even bad CPR is better than no CPR, isn't it, Stu? So, if people do it too fast, that's fine. We know that people are filled with adrenaline, aren't they? But they've also got an ally, haven't they? So who's going to help them on the phone when they call 999? They've got the call handlers, haven't they?
And the call takers will talk you through and will count you down with your CPR.
So they will know if you're going too fast and slow you down. And what if a patient's wearing a bra and we need to use a defibrillator? I think, so we know, don't we? We talked about this earlier, that women are less likely to receive CPR from bystanders. And maybe this feeds into it slightly. If you can remove the bra, that will make it easier to get the pad in the right place, okay? But I'll be honest, if you don't want to, if you don't feel safe to do it for whatever reason or don't feel comfortable doing that, just position the pads around as best you can and please just give it a go. It comes back to the no CPR is worse than bad CPR. No defibrillation is far worse than slightly poorly placed pads. We'd much rather you did something. Is a defibrillator safe when wet? So these are really safe bits of kit, aren't they? I can't remember where I put it, but these are really safe bits of kit. So they're designed to just deliver essentially energy within the body. It's not designed to transfer out. We say dry the chest, don't we? We clearly ideally don't want to shock people on standing water, and therefore you'd move them out. But a slightly damp bit of ground would be fine, wouldn't it, Stu? If you've just pulled someone out of a swimming pool or something, for example, You know, the lifeguards are all taught to just dry the chest, but you certainly don't need to dry the person from top to toe, do you? You just need to be dry in the area you're working.
And it's mainly because the pads won't stick if they're wet either.
Yeah,
So that's
a
the
good
important point about drying. And, you know, me and Ben have done many cardiac arrests in wet conditions and never been shocked by it.
Yeah. How do you swap CPR between two people? That's a really good point that we haven't touched on, isn't it? So we know that pauses in CPR are really, you know, you can be long and protracted, aren't they? So there's two ways to do this, isn't there?
So what I do is, it's really important to have someone who's not doing anything coaching and taking time, and it's really helpful actually to let someone have an overview. And this is where overviews are really helpful. If you someone's doing CPR and they've been doing it for about 2 minutes or getting tired, it's really worth getting someone else to kneel on the other side and then hover their hands over the top. Okay, and then count down 5, 4, 3, 2, 1, and straight on the chest. And that way you don't get that delay in the chest compressions, and that's really key and really important. Doing chest compressions and then getting tired, stopping, getting up, someone else walking over and starting, there's a delay there, and that's not really helpful for the patient. But that said, anything's better than nothing. So, but if you can be more efficient, that's really helpful.
Cool. We've got a question, a really good question, and it crops up often around internal defibs and pacemakers in the chest. So again, I think people worry about these slightly more than they are an issue, don't they, Stu? So we know that a pacemaker or a defib will appear like a little lump under the skin, generally on the left-hand side. Very occasionally it's on the right, but almost always on the left. And essentially you're going to stick the pads in the same place, okay, and you're going to carry on as normal. The biggest risk is that, so a pacemaker won't deliver a shock to fix the heart as such. The defibrillator will, but that's not what the pacemaker's designed for. And we don't know what the two things are doing underlying. So you're just going to attach a defibrillator as normal and follow the advice. Okay, that's the safest thing to do, isn't it?
Yes, absolutely.
Perfect. So we've scrolled down a little far. If we just go up a little bit on the questions, if that's all right. I think we've missed one or two. We had swap in, can you hurt someone? So we talk about risk benefit, don't we? The benefits of CPR far outweigh the risks. So we know that rib fractures and breaking ribs is a complication, isn't it? But it's a recognised complication. People don't get in trouble, do they, for rib fractures? And we generally expect to see rib fractures, don't we, in people who have had chest compressions.
And that may feel a little bit uncomfortable for you when you're delivering CPR to feel that happen. But what I would take the positive from that is you're knowing you're doing effective CPR. So that is the positive from that.
We're going to do the last one or two, and then what we'll do is we'll take some of these and stick them onto social media, I think, and we'll start to answer them throughout the day on social media, because otherwise we just can't get through them all, can we? Which is awesome that we've got so many. So someone said, just to check, we don't worry about the pulse, we focus on breathing. So we don't worry about the pulse, but we tend to de-emphasise breathing. And actually, we can answer a couple of questions here in one go. So the breathing part of it, we don't advise people to do mouth to mouth, because we know that when we ask people to do mouth to mouth, it puts them off doing anything. Okay, so we're not going to check for a pulse, but we do need to check for breathing. Okay, because if someone's not breathing, okay, then we need to start CPR, and we know that pulses are difficult to find. Someone talked about mouth to mouth earlier, so the call handlers won't tell you to do mouth to mouth. If you want to do mouth to mouth, if it's someone that you know and someone very close to you, you may feel comfortable doing mouth to mouth. But generally, the guidelines now will not be advising you to do mouth to mouth. And certainly if you call 999 for an adult, they won't tell you to do mouth to mouth. In children, they will tell you to do ventilation or rescue breaths. But if you don't feel comfortable doing that for whatever reason, there's no expectation. You just carry on and do the CPR. Again, the reason it's been de-emphasised so much is because it puts people off, and that's the last thing we want. We know that your body has a bit of oxygen in the blood already, and if you do good CPR, you can circulate that oxygen, and that will last a bit of time, hopefully until the ambulance arrives. Anything to add about that, do you think?
Only if you're trained to do it, that's different, and you're confident with your loved ones. But the danger also is that you don't do it properly, and then you get distracted from doing proper CPR. So concentrating on one thing and doing the basics well is really key. So I would just concentrate on the chest compressions.
Cool. Lots of really good questions there. I think we might put some more stuff out about defibrillators and pacemakers as well. I think it's difficult to answer that well in a couple of minutes, and maybe we can link to some other stuff. So we're going to wrap up there. I appreciate you've given us a good chunk of your day. We advertised this as a 30-minute session, and due to awesome interaction, we've slid slightly beyond. Thank you for joining us. Thank you for trusting us. Thank you for bearing with us with some audio difficulties at the start. Essentially, we're your local life-saving air ambulance charity, aren't we? We can't do what we do without people's support. We're going to link to a little bit at the end. It's about how you can support us further as a charity if you want to. But if not, that's absolutely fine. And just being here and doing our training with us today is enough. Thank you.